Welcome to St. Mary's Hospital. We'd like to show you our family birth center and offer you a glimpse of what will happen the day your baby is born. If you're coming in for a scheduled procedure, or if you're in early labor and are comfortable, you may park in the hospital ramp and enter through the sky bridge. Monday through Friday during the day, we encourage you and your visitors to take advantage of our complimentary valet service at the main hospital entrance on Brook Street. Information desk staff can direct you to the birth suites. For more immediate needs, please enter the hospital through the emergency entrance on Aaron Street. The emergency room staff will help you get to the birth suites. Pre-registration is encouraged before admission. To pre-register, call the hospital's Patient Registration Department at 608-258-6655. Welcome to Birth Suites. A nurse will greet you at the Birth Suites nurses station and escort you to triage. Our triage area is used to evaluate and assess labor. It is also used to prepare for scheduled procedures. This is a good time to share your birth plan with your nurse and include any preferences or specific plans you may have for your birthing experience. It is also important to discuss your birth plan with your doctor during prenatal office visits. Our resident physicians will work with your doctor during your labor and birth. You may have family and friends of your choice to support you during labor. Each birth suite contains a television with VCR and DVD and a shower or bathtub available for your use. If you plan to have other children present during the birth, please make arrangements to have a friend or family member with them at all times during your labor and birth. As your labor progresses, your physician, residents, and your nurse will provide ongoing physical assessment and support you through your birth experience. When it's time for your baby's birth, the equipment needed for delivery will be brought into the room. The bed serves as both a labor and birthing bed, making it unnecessary in most cases for you to move before the birth of your baby. If you're having a cesarean section, the birth will occur in our unit's operating suite. Anesthetic options for cesarean birth can be discussed with your doctor or anesthesiologist. If your support person is not in the cesarean birth room at the time of birth, he or she will have an opportunity to see your baby within minutes of the delivery. After your delivery, you will spend up to 2 hours recovering in birth suites. Once your baby is born, your nurse will weigh and measure your baby and record his or her vital signs. Footprints will be taken and a security band will be placed on your baby's ankle. During the first hour or so after birth, your baby will be alert, which makes it a perfect time to begin breastfeeding and bonding with your newborn. When your recovery is complete, your nurse will move you and your baby to the family care suites. She will share a report of your birth experience with your family care suite's nurse. Your new nurse will greet you, get you familiar with your room, and frequently check on both you and your baby. Your family care suite's nurse specializes in postpartum care, and she will carefully monitor you and your baby for the rest of your stay at St. Mary's. On-demand feeding is encouraged for all babies. Your nurse will provide support and assistance with your newborn feeding choice. Lactation specialists are available for breastfeeding assistance. While in the hospital, your baby will receive his or her first bath, a non-invasive hearing test, and a newborn blood test. You're encouraged to keep your baby with you in your room while you're in the hospital. However, our newborn nursery, staffed by nurses, is available for you to use as desired. If you wish, your baby's photo may be taken and placed on a secure website. Another way to share your birth experience and photos of your baby with your family and friends is through our online service called Care Pages. And the growing family photography company also gives parents the opportunity to purchase photo packages. Friends and family may visit at any time that is convenient for you. Visitors who wish to hold your baby must first wash their hands. Throughout your entire stay, nursing staff will provide ongoing education about care for you and your newborn. Check with your nurse for information on new parent educational videos. There are programs available on request for viewing in your room. All patient rooms have video players. You can also watch our newborn station on Channel 23 for ongoing education. Each mother also receives The Next Step, a binder filled with helpful parenting information. Your nurse will review this book with you prior to discharge. If an emergency arises or if specialized care is needed for your baby, he or she will be admitted to the hospital's on-site neonatal intensive care unit for close monitoring. Neonatologists are in-house and readily available 24 hours a day. Parents with babies in the neonatal intensive care unit are encouraged to visit, hold, and bond with their baby. You and your physician will discuss your plans to go home from the hospital. Your nurse will go over this discharge information with you as well. When you're ready to leave the hospital, your nurse will check the baby's identification with yours. You will be asked to read and sign the newborn identification record. If you wish, your nurse will arrange for someone to escort you and your newborn to your car. State law requires that all infants and children travel in a car seat. It is your responsibility to know how to properly secure your baby in a car seat and to know how to secure your car seat in your car. It's a good idea to learn this before you come for delivery. Infant car seats are available for purchase at St. Mary's. Our entire team, from our award-winning nurses to our exceptional team of specialists, is here to make your baby's birthday every bit as wonderful as you imagine. We are honored that you have chosen St. Mary's Hospital to share in your birth experience.